I mean, it's one of those things that's just part of every checkup. They clip it on, you see a little red light, some numbers pop up, and then it's off. But have you ever stopped to wonder what it's actually measuring in those few seconds?
Well, the official name for it is pulse oximetry. And what that really means is it's a quick, totally painless way to check how well your blood is doing its most important job, which is, carrying oxygen from your lungs to literally every other part of your body.
So how does it do that with just a little light? This part is actually pretty genius. The device sends these tiny beams of red and infrared light right through your fingertip. And get this, blood that's packed with oxygen absorbs that light differently than blood that isn't. The oximeter just measures that difference and turns it into a percentage, all without a single needle. Pretty cool, right?
Okay, so we know what it is, but why is this little number so important? Let's dive into why doctors and lots of other people are so focused on monitoring the oxygen in your blood. Well, for anyone dealing with conditions that affect their lungs or heart, we're talking about things like COPD, asthma, pneumonia, or even heart failure. This little device is absolutely critical. It gives them a real-time snapshot of how their body is doing and if their treatments are actually working.
And it's a huge deal in hospitals, too. Doctors use it to answer all sorts of questions, like, is this new medication helping? Does this patient need help breathing? How is someone recovering after a major surgery? Pulse oximetry helps them figure all that out fast.
Now, these devices are everywhere, and a lot of people have them at home. So it's really important to know how to take a proper reading, because it's not just about clipping it on. A few simple things can make a huge difference in getting an accurate number.
First things first, dark nail polish can actually block the lights, so you want to use a finger that's polish-free. Also, if your hands are freezing cold, that can mess with the reading, so make sure your hand is warm and relaxed. And then, probably the most important part, just stay still for a few seconds until the number on the screen settles down.
Okay, so you did all that. You've got your reading. Let's say it's 97%. What in the world does that actually mean for you? Let's break down what you're looking at.
For most of us, if you're generally healthy, a normal reading is going to be somewhere in the range of 95 to 100%. That's a great sign. It means your blood is fully loaded with oxygen and delivering it where it needs to go. But what if that number starts to dip? If you see a reading that's consistently 92% or lower, that's a signal to pay attention. It could point to something called hypoxemia, which is a seriously low level of oxygen in your blood. And that's definitely a good reason to give your doctor a call. So here's the bottom line. Your body cells need a steady supply of oxygen to stay healthy and do their jobs. To keep everything running smoothly, you really need that oxygen level to be at least 89%. Anything below that for a long time can start to cause problems.
So far, this sounds like a pretty amazing, straightforward little tool, right? But it's not that simple. There's a really important complication we need to talk about, a critical flaw that has some major implications.
And that leads us to the big question. We're putting a lot of trust in this little number. But what if that number isn't telling the whole story for everyone?
So here's the issue. It turns out something as simple as a person's skin tone can actually affect how accurate the reading is. The melanin in darker skin can absorb some of the light from the oximeter, and that can throw off the device's calculations.
And this isn't just a tiny error. The real-world impact is, honestly, it's pretty shocking. A landmark study in 2020 found that for Black patients, these oximeters were 3 times more likely to miss dangerously low oxygen levels compared to white patients. That means people might not be getting the treatment they need because the device isn't showing the true picture. It's a massive, massive disparity.
So why does this even happen? Well, the root of the problem goes all the way back to how these things were designed in the first place. The technology was developed and tested mostly on people with lighter skin. So this bias was basically built into the device from the very beginning.
So, knowing all this, what do we do now? This doesn't mean we should just toss these tools in the trash. It's about being smarter and using them with a full understanding of what they can and can't do. So here are the key things to remember. First, a pulse oximeter is a helpful tool, but it gives you an estimate, not a perfect measurement. It's definitely not as accurate as the gold standard blood gas test they do in a hospital. And critically, you have to be aware that it might be less accurate for people with darker skin tones. The most important thing? Always talk to your doctor about what your readings mean in the full context of your health.
And that really brings us to the main point here. The pulse oximeter is a powerful tool, no doubt, but it's not perfect. Knowing its flaws is actually a form of power for you as a patient. So the real question is, how will you use this knowledge to advocate for yourself and make sure you're getting the full picture of your health?